Hi, I'm Ashton, and I'm going to be your occupational therapist today. Today, we're going to work on some medication management strategies with bipolar disorder and hypothyroidism. It's really important to stay very consistent with your medication to ensure that it works effectively and to make sure that we're safe. So, with having a list of medications, it's good to just get it all organized and set up for ease and to ensure the effectiveness of it and make it less of a hassle. What we're going to do today is two main things. We're going to organize our pill organizer here, and then we're going to establish a little morning routine. And both these things will um, like I said, help us organize things and keep it consistent. And that way we don't really have to think about it and we're safe and we're on the ball and it's one less thing to worry about. So I see here that we're on lithium, Lamictal, and levothyroxine. So let's talk about some of those precautions with those. So with lithium and Lamictal, it's not really safe for women who are pregnant or nursing. If you are planning to do one of these things, you need to consult your doctor immediately. Lithium is unsafe for those with heart disease, kidney disease, or if you're about to have a surgical procedure done. Like I said, check with your doctor. That medication will probably need to be discontinued a little bit in advance to make sure it doesn't affect that. With lithium, it's very crucial that you don't ever take a double dose. If you miss one, wait until your next time to take it. Don't take a double dose. It can be very toxic to the body. And with Lamictal, it's not recommended for children under 12. And you should not be taking any medications that contain estrogen or any contraceptives that set out estrogen. And then with the levothyroxine, it's not to be used to treat obesity or to lose weight. It's also not safe if you have any adrenal gland problems or if you've recently had a heart attack. So hopefully none of those things are anything we have to worry about, but good to keep those in mind. So there's, a complete list of side effects that are sometimes seen with all these medications online, but I'm just going to go over a few of the main ones for each of this so you can be aware if any of them are too overwhelming at any point in time. Make sure you get in contact with your doctor and we can adjust the levels, the dosage of the medication, and make adjustments to get the right dosage for you. So with lithium, you might see some nausea, a little bit of dizziness and fatigue, some dazed feelings sometimes, frequent urination, some swelling and weight gain. All those are sometimes seen with lithium consumption. With Lamictal, you might get some fevers and rashes if possible, aches and pains, blurry or double vision. You might get some stomach cramps and some dry mouth. And then with levothyroxine, you might get faster regular heart rate, fever, increased blood pressure, might have some difficulty breathing or swallowing, fatigue, or even some changes in menstruation. So these side effects are a little more severe and definitely need to keep an eye out for those things and be in good contact with your doctor. Alrighty, so we said that we are going to get our pill organizer out. So this is what a pill organizer looks like. You can see here that there's an AM and a PM, and then it goes for a whole week. So if you want to get two of these and do 2 weeks at a time, that's totally fine. And then it just snap open there. All right, so before we got that, and we're going to start by making a little list of our medications. So what I've got here for you is lithium, and then the dosage we're going to take. So we're going to take 0.6 grams twice a day, once in the morning, once at night. Lamictal, we've got 100 milligrams twice in the morning, or twice a day, excuse me, one in the morning, one at night. And levothyroxine, we have 0.125 milligrams in the morning. So just having a little list here, and that's good for when you go to refill it. That way you can just look and check everything off and make sure you have it. And keep that as you're filling it. So now, if I can have you try, we're going to stick both lithium and lamictal, one in each of the top row and one in each of the bottom rows. So if you can unsnap them there and put those in there, if you see the bottom here is what the finished product should look like with the pills in it there. So if you can try that. And then we're going to do one of the levothyroxine in the morning in the purple there. So if you can try that, just snap open, make sure they get closed. It's a mess if they all fall over the place. Alrighty. Very nice job. All right, so the next thing we're going to look at is establishing a morning routine. If you're like me, you're not a big morning person, but if you establish a little routine, it makes things a lot smoother, and it'll be good for our medication management skills. So the levothyroxine needs to be taken in the morning on an empty stomach with 8 ounces of water. So if we want to get a little system here, and since you have to be at work by 9 a.m., what my recommendation would be setting an alarm in the morning on your phone. So hopefully you have a cell phone here, and hopefully we can see that. So you can go to your alarms on your phone, and we can click here, and we can set it for 7 a.m., and then we can go down here and pick which days we want it. So we've got it set on every day. We want to do it every day regardless of whether we have work or not. That way we can be really consistent and just keep it smooth and simple. So we'll check mark all those and then hit OK. You can change your sound type and the volume. And then we want to go ahead and put it on snooze for 5 minutes, and we want to do it 3 times because I don't want you to dismiss this alarm until you actually go in and take your medication. So we hit done there. We got one for 7 a.m. and 7 p.m. So when the alarm goes off, we go into the kitchen, take our medication with 8 ounces of water, and then I would recommend from there, maybe doing some of your morning personal grooming and hygiene routines, and that way it gives you a little time to let the food settle for let the medication settle for about 30 minutes before you consume some food. And then you can go on about your day. And then same thing for the 7 p.m. at night. We can set it for nighttime, and then, you can have dinner right around 7:30 after you finish consuming those. So if you'll try that for me now, go to, most of them are pretty standard, but mine's up here under clock, and then alarms at the top. All right. So that's great. If you have any questions, just let me know and we can do all this. It's going to be a really good thing for you, and once we get consistent on all the medication, it should really help alleviate some of your symptoms and make it easier to go back to your routines and your roles and going to work. So appreciate you and have a great day. Thanks.